Hello, everyone, and welcome. It is Wednesday, July 22nd, and I am glad to get to be with you yet again today. In true Jen fashion, I am going to give you an updated case counts both locally and for the state. Then we are lucky enough to have our data expert from the Crosse County Health Department, Jacquie with us to provide some important updates. Then I will return for some additional highlights. First, I would like to go over our local numbers. For today, we have 12 new positive cases for a total of 685 lab confirmed cases. We have, for a total of 578 have now recovered. Also, we have 107, that means we have 107 active cases. Currently, we have 6 people hospitalized, and ever hospitalized in La Crosse County, we have had 32, and we have 1 death. For the state, they had a total of 44,000, apologize for that, 44,847. This is an increase of 712 from yesterday. They have a total of 764,630 negative cases, and that's an increase of 14,068 from yesterday. Total recovered, they have had 34,682, which gives them a total of 9,285 active cases. Currently hospitalized, there are 31, and ever hospitalized, there are 4,225. There were 6 new deaths for a total of 865 at the state level. Just want to update everybody that today our compass has moved from the orange, which is our high risk category, to red, which is our more severe risk category. Some of the factors involved in this change are due to the metrics that we use to create those numbers. Our data expert and also our operations section chief and our nursing manager, Jacquie, will provide a brief overview of some of those changes. With that, I would like to introduce Jacquie to talk about La Crosse County data.
Hi, my name is Jacquie. I am the Public Health Nursing Manager at the La Crosse County Health Department, and I'm going to share some information about our compass. Before I actually delve into the specifics of how the data has changed and some new additions we made, I want to talk about why we made those changes and the overall purpose of the compass. The compass was originally developed by the La Crosse County Health Department in partnership with other counties in our region to create a way to communicate risk to the public. We wanted to take all of the different data points that we were looking at and bring that into one tool that would help our community understand the risk, not just in terms of the number of cases or the number of deaths, but other factors like our healthcare system capacity, the ability to test enough people, the ability for those tests to be quickly referred to public health, and for our public health system to reach cases and their contacts in order to reduce the spread as quickly as possible. So it was kind of this desire to be as inclusive as possible and being open and transparent. It is because of that process that we are always trying to be iterative learners. That means that when we know better, we do better. We review evidence all the time. We are in constant communication with our local and state partners. We review information that comes from the Center for Disease Control and Prevention and from other international and national bodies of literature. In the process of reviewing information, we've identified ways to improve and better assess risk, which is how we decided to change the compass. I'm going to talk about those specific changes now. And in order to make that a really productive conversation, I'm going to share my screen so that you can follow along with me. So this is the landing page for the compass. any of you who want to follow along are welcome to do so. Because not everybody is familiar, I'm going to walk through some of the basics as I go. The landing page that you'll come to, lacrossecounty.org/COVID-19 Compass, lands on the home page. This provides an overview of our current status based on whatever region you are selecting at the time. When you open the compass, it will land on our region, but you can select from the drop-down menu any of the counties, individual counties in our region, which include Buffalo, Crawford, Jackson, La Crosse, Monroe, Trempealeau, and Vernon. I'm going to select La Crosse now to keep our data related to the county that we're talking about. So what you'll see here, if you hover over the current compass status, you'll see the date that it's set to, and there's actually an error there, so I'll fix that. But it'll also talk about as of the 21st, so you can see that the date is right there. The epidemiology status overall for that category is red, healthcare status is yellow, and public health status is red for our region. And you'll see something very similar for La Crosse County. The second page is current status and recommendations. So here you will see the same compass. So this is just the same thing, which you can select which region you want. And it will tell you based on the date that shows up when you hover, what the risk is. And you can coordinate if we're in severe risk, which is where we are right now. That red column coordinates with the one below it, orange to orange, yellow to yellow, and green to green. Now I'm going to talk about the individual changes. So within the epidemiology status, the biggest change we made to EPI, metric 3 used to only look at percent change. We needed a way to talk about how our cases were growing or shrinking, because especially early on in the pandemic, when we were first getting started with Compass, we were starting to get more and more cases and wanted to have a way to really capture that. Now that we have hundreds of cases, it makes sense to really think about not just the change or trajectory, whether the number is going up or going down, but also to think about the overall number of new cases. For example, during a 2-week period in June, we had almost 250 cases come in during a 2-week period. In the last couple of weeks, we've had 153 cases come in over a 2-week period. To go from 250 cases to something like 150 cases, that is a substantial decrease, or like the trajectory is going down, so you know that it's shrinking. Metric 3 could have become green by seeing a change that was essentially half, going from 250 cases to something about half of that. But 150 cases in a 2-week period is still a lot of cases. We try to think about overall risk to the public. So what is your risk as a member of the public for coming in contact with the virus? And what is our ability to respond to any cases that we see? For this reason, we've taken into account now both the actual overall new case rate and the way that it is growing or shrinking. So when you hover over this light now, you will see that the trajectory is currently growing for our region, that the case burden, so that's the overall number of new cases, is high, what that new case rate is for the most recent 2-week period, and the percent change in the number of new cases. So for our region, you'll see that it's increased by 9.9%, that the new case rate is 129.3 new cases per 100,000 population, that the case burden is high, and that the trajectory is growing. For La Crosse County, using data through yesterday, you'll see that our case trajectory is shrinking, but that our overall number of new cases is still high. The metrics that we use to set whether a new case rate is high, moderate, or low are actually the same thing that DHS does. So we wanted to be in alignment with the Wisconsin Department of Health Services. And this is the website that they use to provide that information about activity level by region and county. So we use the same formula that they do and the same cutoffs that they do. And if you want to talk more about how those numbers are calculated, you can certainly refer to this website. They talk about the burden. So this is what I was talking about before. Low is a case rate is less than or equal to 10 cases per 100,000 population in the past 2 weeks. Moderate is a case rate of greater than 10, but less than or equal to 50. Moderately high is a case rate greater than 50, but less than or equal to 100. High burden is defined as a case rate that is greater than 100. By factoring in both the burden and the trajectory, we're able to have a better understanding of risk. The next change I'm going to talk about is one that happened between healthcare and public health. So public health used to have 4 metrics, metrics 7, 8, 9, and 10. Metric 7 is how quickly public health is notified of a positive case after the test has resulted. So the way that that notification happens is when a test says that a case is positive, somebody in a lab or a health system has to enter that information into the Wisconsin Electronic Disease Surveillance System, or WEDS. We look at the cases in WEDS every day of the week and assign them out to investigators. If information isn't getting into WEDS quickly, we don't know that that case exists and we cannot investigate it. That is why our goal is that all cases are referred to us within 24 hours. And that's a goal that's actually set by the state of Wisconsin because COVID-19 is considered to be a Category 1 reportable illness, which has that 24-hour reporting goal attached to all Category 1 illnesses. When we really sat and thought about the different categories of healthcare and public health, one thing that really comes to light is that public health has no control over when cases are referred to us. It really is a matter of the lab entering that information into WEDS and reporting that in a timely manner. So if laboratories are not able to report cases to us within 24 hours, that's something that lab capacity has to deal with, how they get that information into the system. It's not something that the health department has control over, which is why we moved metric 7 from public health, where it was previously, to healthcare, because it is more in line with healthcare or laboratories and the capacity to enter those information quickly so that public health is able to reach out to cases in a timely fashion. Because we made that change, you will see that the healthcare status light now factors in metric 5, metric 6, and metric 7. On the same page, we've added some graphs so that you have this information more accessible to you. So previously, all you were able to see are these individual lights. Now you actually are able to look at the data that flows into that light at the same time. Similarly, you'll see information about ventilator availability, about the percentage of hospitals in our region that had less than 8 days of medical masks and N95s. And then the last 2 look at the number of patients hospitalized with COVID-19 in our region. So that's not specific to La Crosse County, that's our region as a whole. And the number of deaths and percentage of cases that died of complications from COVID-19. So you'll have access to all of that data now as well. And as I mentioned previously, we removed metric 7 from public health and moved it to healthcare because it really does coincide more with healthcare capacity than public health capacity. We also made one additional change this afternoon that I wanted to share with you. So I very much appreciate the frustration that people have voiced about our ability to connect with cases and contacts quickly. But I wanted to talk about why we've struggled with that in the past few weeks so that you understand the same kind of environment that we are working in. So I added this graph to the bottom. It is the average number of days it takes for our county or for La Crosse County Health Department or people working under or with us to contact cases. And you'll see kind of this grayed out box here. This is the time when we had such a surge of cases and we were still trying to get more contact tracers up and running that we couldn't take all of our own cases ourselves and we had to ask for surge support from the state. So that means that if there are cases we know we aren't going to be able to contact quickly, we were sending them to state investigators who were able to try and help reach those people that we couldn't get to ourselves. When we had hundreds of cases coming in each of those 2-week periods, that was too many cases for us to reach quickly, which is why we used the state. During that time, a whole lot of other counties in the state were having the same problem, and we were all trying to utilize state for surge support while we got more and more staff on board and trained. That is why you'll see this grayed out box. The average response time to reach cases goes up during that time because state had a lag time. And we very much appreciate having had a place to get help, but it was kind of just part of this whole experience that there were so many cases that it was hard to get all of them reached at the same time. You'll see that about 1.5 to 2 weeks ago, we started taking our own cases back. So the reason that we were able to do that, beyond just the fact that we've had less cases now than we did during June, is because we increased the number of our staff. So we've brought on 16 new people. We're orienting 4 more next week. We're planning to bring on more the week after to really get more staff who are able to do that work. We also changed a lot of our processes to reach cases faster. So we created a HIPAA compliant dot form, which we're able to send to cases, which we've also been able to use with our healthcare partners to quickly contact and connect with people to identify their jobs and where they have been in the community. And that has dramatically reduced the response time. So when we were sending cases to state in early June and part of July, the average days to reach a case was up to 8 days, which is of course not at all our goal. Since we've started taking them back, we are often hitting that goal of trying to be less than 24 hours. So I would expect in the next 2 to 4 weeks that all of those public health metrics will improve, provided that there aren't any other things that I can't foresee in the future. But we have made a lot of progress with that, and we wanted to share that information with you so that you understand where the changes have been. And then the last thing I wanted to share is how to navigate the case data page. So this is kind of also an iterative process. We've changed this over time. We continue to update it, and there are some additional data points that will be added. You'll see here the total number of cases. So this is only La Crosse County data. This does not include any data from other counties. You'll see the number that are currently active at home, those that are hospitalized, those that are deceased, those that are considered recovered. Depending on when I press the button that updates it, this might be a little bit different than what's on Facebook, and it's just about the amount of available data I had at the time when I was updating the page. You'll also see information about demographics like age, gender, race, severity. Origin is really, can we figure out where they got the illness? If they were a close contact of a positive case, if they were likely attributed to travel outside of our county, or if we have no way of identifying where a case came into contact with the virus, then that's where we have community spread, if we can't name a place that you went to get it. You'll also see the sample sizes underneath. You will see that some of them are, so 673, that's the sample size that we're currently working with. So we have this data available for cases that we have been able to connect with and that have provided that information. So you'll see that the sample sizes are different based on what the particular data point is. And the last thing that I wanted to walk through on this page is these date filters. So some of the data points have a date filter, like this one. You can see how things change over time. You can drag the filters and it will show you how the percentage of a particular age group changes with time. You'll see that if you select the month of June, that there was a surge in the 20 to 29-year-old age range. Okay, so that was what I wanted to talk through about data. The other thing that I wanted to show you today is an example of contact tracing and why it's really important. So I'm going to walk through one of the chains that we had in June. I've tried to remove any potential identifying information just to give you an idea of what contact tracing means, how we use all of this to think about risk, and why we make specific asks of the public. So this first case in this chain had a meal at an area establishment on the 29th of May, and then developed symptoms on the 31st of May. So this person had no way of knowing that they were ill at the time that they ate this meal at this establishment. But from that person who was spreading while they were asymptomatic, there were 2 people that we could link specifically to that case. The first one went to that establishment at the same time. So that person was also in the establishment having a meal at the same time on the 29th of May. They developed symptoms on June 4th, and they work in an assisted living facility. They were working there while they were infectious on the 4th. The second case was working at the establishment where these people had their meal. They worked on the 6th and 8th of June and developed symptoms on the 8th of June. That person, so the person who worked at the establishment, exposed a coworker who worked on the same day that they had symptoms, another coworker who worked on the day that they had symptoms, and also went to 2 healthcare systems for non-illness purposes on the 8th and 11th of June, exposed a patron who worked in a different assisted living facility and went to a different establishment on the 14th, and then another patron who worked from home but had a get-together with friends while they were infectious. This individual, so this is one of this person's coworkers who was working at this establishment, exposed another person who went to a different city. So this is a patron, so somebody who came to that establishment to eat a meal, went to another city and went to a whole bunch of stores and hotels while they were infectious. Another coworker who had a second job in an area healthcare system and who went to Woodlands and Quick Trip on the 10th and then went to work at a healthcare system on the 11th and 12th. They exposed a household member and an out-of-state family member. So all of these red dots represent confirmed positive cases. This third person, remember this was a customer, but they have a job in assisted living. There were 12 cases that came out of that exposure. And then from the second customer, so the fourth person that was the fourth case that came out of this exposure, they had 2 out-of-county friends that they were together with when they were infectious that both became positive. From that, an additional 5 people became symptomatic between the 15th and the 18th, all connected to this second person. So from this one chain, we were able to identify that one asymptomatic person on the 29th of May led to 29 confirmed positive cases and 75 named contacts, with hundreds of additional patrons that were exposed in less than 3 weeks. We do this kind of contact tracing for every person that we can conceivably connect to somebody else. You can imagine that the amount of time it takes to develop that level of detail is significant. But we do that because we think that it helps us to identify sources of risk. So as I mentioned, our goal is to reduce the risk in every way that we can because we care deeply about our community. We live here, we work here. What we want to do is reduce risk for everybody that we can, or at least notify you of where that risk is so that you can make as intelligible decisions as you can. That is why we do that contact tracing process and try to figure out where the sources of risk are. And that's why we share that with you when we feel that something was high risk and worth noting. That is also the reason why we ask people to do things like wash their hands, wear a mask when you're in public, stay away from large groups of people, don't congregate in large groups outside your household, or if you're going to get together with friends, do so outside, physically distance yourself, wear a mask if you can. Those are not things that we ask for anything else other than we want to protect you and we want to protect our community. And we have that insight of doing things like contact tracing where we can link one person who didn't have any symptoms, who just decided to eat a meal, to 29 positive cases, 75 contacts, and hundreds of exposures. So when we look at that from one person and recognize that there are many of those potential scenarios, we want to help you enjoy our community and your family members and all of your outings in the safest way possible, which is why we ask you to do those things, because we think that it will improve the likelihood that we can reduce the spread of illness and prevent it from transmitting to other people, to keep our economy as functional as possible, and to prevent our healthcare systems from having more and more hospitalizations. So that was all I had prepared, but I'm happy to take any questions that you might have about data or contact tracing or why we made changes to the compass, anything at all.
And Jackie, we're going to do Q&A after a few updates from myself.
Thanks.
I want to say thank you very much, Jackie, for providing those metric updates as well as the data updates that you provided, and then a brief snippet into what contact tracing looks like. We can all see that that does have an impact in our community. And as part of that, I just want to remind our businesses that we continue to run the check the spread campaign, and you can sign up. So there are actions that businesses can do to take control of what happens in their establishments. And that is one of the things that they can do. They can look at the check the spread campaign and sign up to say that they're on board with providing some of those safety measures. Currently, we have 141 participating businesses, and we would like to thank them. The next piece I would like to update everybody on is that we have the results in from the National Guard testing site from July 10th. From that event, we completed 397 tests. 20 of those were positive, and 16 of those 20 were La Crosse County residents. On Friday, July 24th, I just want to remind everybody, from 10 to 4 at the Onalaska Omni Center, there's going to be another National Guard testing site. This site is going to be a little unique. You're going to be able to pre-register for Friday's event with an app, and you can log on to our website or visit our Facebook page for more information on this. This app will allow you to register, and it will allow for our event to be more efficient with shorter wait times and faster lines and less paperwork for you to do when you get on site. You can check in from your car when you arrive. Now we can go into some questions and answers.
Do we have any media questions today for Carol or for Jackie? I'm not seeing any hands up, but we can give it a quick minute here.
I see a question. Do you see that, or do I need to give you something?
Oh, yep. Hang on a second. And in the meantime, Carol, we do have a question from Facebook about somebody saw a message about vented masks and what our recommendations are around those masks.
Jackie, do you have any information about the vented masks?
Yep. So our purpose with a mask is we want to protect other people from us. So your mask protects me, my mask protects you. Because that's the purpose of the mask, if you have a vent in the mask, you aren't really preventing yourself from expelling something into the air. And that's why our recommendation is not to use vented masks, because that doesn't prevent you from expelling particles into the air. It's why we would really encourage people to be wearing either fabric face coverings or what other kind of mask that you have available, but preferably not one with a vent, just in order to protect those around you, which is part of why we ask you to wear masks, is to protect those who you're near.
Hello, can you hear me?
I can hear
Yep.
you.
All right, so I have a quick question. What healthy living measures can people take so that if they are exposed to COVID-19, they're healthy enough to fight it?
And Jackie, as you're in the nursing realm, I will let you take that one.
No problem. So as healthy as you can be is always the best way that you can live your life. So a lot of coronavirus is a respiratory illness, not all of it, and certainly some people have different presentations. But if you're currently smoking, great idea, great time to stop doing that. Will help your lungs to function better if you have respiratory illnesses in general. It will also help your immune system to function more optimally with whatever kind of illness you have. We definitely want to encourage people to be eating healthy, to be active. So don't want to go necessarily to an indoor gym without wearing a mask. That would be a high risk activity, but running outside or working out at home, those are all good things to do. Drinking lots of water, all the kind of infection control practices we talk about regularly. So wash your hands, cover your cough. If you know that somebody is ill, don't hang out around them. I personally ask my own small group of people that I will get together for socially distanced activities outside. I still ask them every time we do that if any of them have had any symptoms in the past 2 weeks, and if they have, we don't get together. It's just a really good way to generally try and protect your health, regardless of whether it's coronavirus. The other thing I would encourage everybody to do is to get their flu shot. This fall, we anticipate that there will be a surge in COVID cases for lots of reasons. It's also the time that we're going to see a surge in flu virus because that happens every year. If we have influenza-related hospitalizations at the same time that we have COVID-related hospitalizations, that's where we could really start to see an increase in the number of hospitalizations overall and a decrease in the availability of resources, including beds, supplies, staff. So by getting your flu shot, it helps to address potential healthcare system problems that could happen later. So please, please, please get your flu shot. And if you don't know where to get it, let us know and we'll hook you up.
Jackie, we are getting a lot of questions on Facebook about why we went to red. And I know you just went over that with the Compass website. Could you kind of give a quick overview of really why we're in red right now?
Sure. So the Compass determination, what overall color we're in, is a factor of those 3 different overall categories. So if any one category, if only one of epidemiology, healthcare, and public health, if only one of them was red, we would be in orange. It's when 2 or 3 of the overall categories are red that it tips the compass into red. And the reason why La Crosse is red this week is because both the public health metrics and the epidemiology metrics were red, and then the healthcare metrics were overall yellow. What we need to do to get out of that, we need to see a decrease in the number of cases below 100, below that case rate. So below 100 new cases per 100,000 population, which translates to less than 110 cases, I think, in a 2-week period. And then we would need to continue making improvements in our ability to connect with cases and their contacts. So that's a function of a couple of different things. It is our ability to place phone calls, but that has largely dropped below the 24 hours mark in the past week. So I expect that metric 8 will be at least yellow, if not green, at some point in the next few weeks. But being able to connect with contacts, that is partly cases being willing to share their contacts with us. It's also about the contacts being willing to pick up the phone and answer the call to provide information to us. So it's really a public-private partnership. If we want to get our community not just change the color, but if we want to reduce the risk, which is what we're really going for with the Compass, we need cases and contacts to be responsive to the health department. And we're not trying to infringe on anybody's rights or invade their privacy or ask them a bunch of questions. We're really trying to limit the spread or the risk of spread to our community. So do we have the potential to go back to orange or even to yellow at some point in the future? Absolutely. But in order to get there, we need to work together to make that happen. So doing a lot of those things that we talked about previously is what's going to help us get the Compass back to not a severe risk stage, because that will reduce the risk overall in our community. And that's what we're really trying to get at with the Compass.
Any other media questions for Jackie or Carol? Looks like we have one.
Yes, am I coming through here?
You bet.
Perfect. Under a severe risk or red alert, what would be advised for schools as we get closer to August?
Yeah, and I will take that question. I can tell you that we are having regular conversations and working closely with all of the schools in the area, and that uh, there will be information coming out in the next couple of weeks that will really say what's going to happen in those categories. Out of respect for working with the schools right now and allowing them to develop their plans based on new conversations that we've had in the last week with them, I'm going to let them develop their plans just a little bit further before we release that. But obviously, you know, that's a type of setting where there can be some risk to the people that would be entering those buildings. So, you know, that is something that we're taking into consideration when we're in those high risk categories. Thank you.
With Minnesota now having a statewide mask mandate, what are your thoughts on that? And is that something you'd like to see for Wisconsin?
Yeah, so we did see that they were doing that today, having their statewide mask order come out. And then, you know, I don't know if that's done best with a statewide order. You know, we've seen lots of different municipalities and or counties that have issued those same types of orders. It is one of those things, you know, at any time an order is challenged that it, you know, really makes people stop and really try and figure out, is that something they should be doing? We know that there is a reduction in spread when people are wearing their masks, and so we are looking to have more and more places do that. Presently, you know, it's part of our Check the Spread campaign where we have those businesses saying that they're going to have their staff and customers that come into those places wear masks. And something that we're looking into even just a little bit more further within our county, and potentially doing something with an order that way if nothing would be done on the statewide level.
Any last questions for Carol or Jackie? I don't see any, Carol.
All right, then I just would like to thank everyone. I'd like to thank Jackie first for coming on and joining us and giving us an update about our metrics and our data that helps form our compass. I'd like to thank Colleen for being on and providing services for us. We really appreciate that. And then I'd like to thank all of you for joining us. Just a reminder that Jen is back next Monday to provide the updates and information for you. And I thank you all for the opportunity to have provided this information during this past week.